From Riverside Health System, this is the Healthy You podcast, where we talk about a range of health-related topics focused on improving your physical and mental health. We chat with our providers, team members, patients, and caregivers to learn more about how to maintain a healthy lifestyle and improve overall physical and mental health. So let's dive in to learn more about becoming a healthier you. Well, first of all, I'd like to welcome you to the Healthy You podcast. And today we're going to be talking about preventing and screening for colon cancer. And I'm really excited that I have with me Dr. Michael Ney, gastroenterologist with Riverside Gastroenterology Specialists. Welcome, Dr. Ney. How are you?
Thank you. I'm great. Thanks for having me.
Yes, my pleasure. My pleasure. So let's get into it. Want to talk a little bit about colorectal cancer and screening. So first and foremost, tell me how you end up specializing in gastroenterology.
Well, I guess everyone has their own path, but for me, it was just, basically when I was in medical school, it just turned out to be the thing that I liked the most, found the most interest in, and then I just kept being the same way as I went through. And by the time I was done internal medicine residency, nothing had changed. So I kept on going and did gastroenterology, and I haven't regretted it at all. It's been a great career so far.
Oh, yeah, I can recall trying to decide which area of nursing I wanted to be in. So I quickly knew areas that probably wouldn't be the best for me. So what did you specifically like about gastroenterology and becoming a gastroenterologist in particular?
So it's a really great area of medicine because number one, you get to kind of work with a really broad range of patients. So kind of all races, ages, men, women, kind of everybody from that respect. We get to split our time between doing life-saving procedures as well as seeing people in clinic. So the day is kind of always interesting. I'm kind of always doing something different, which is great. And it's just really fulfilling, helping people not only with gastrointestinal diseases, but also actually, helping just kind of the general public that are coming in for colon cancer screening, because we can actually save lives with this procedure, which is, a really fulfilling part of the job.
Absolutely. Absolutely. Thank you for your passion and your work in this space. What is colorectal cancer? Talk a little bit about that for me.
Yeah, so I mean, I think most people have kind of some sense of what a cancer is, and of course, cancers can start in different tissues or different organs. So colorectal cancer is simply a cancer or an abnormal growth of cells that begins to grow in the colon or the rectum, which is kind of the large intestine, the continuous tube from the anus up to where it meets the small intestine. And basically it's just simple as that: cancer in the colon or rectum.
Well, I know I have some personal background as it relates to colon cancer. I've had some people, family members and some dear friends, and it just seems to be a very aggressive cancer. They were unfortunately diagnosed very late and are no longer with us. Can you talk a little bit about what are some of the ways to screen and kind of be able to be on top of just early identification as it relates to colon cancer?
Absolutely. So first of all, I'm sorry to hear that about your family members and friends. It's an all too common story with such a common cancer. So in terms of mechanisms for screening for colon cancer, the kind of three main things that I recommend are either a form of stool testing, which is either a FIT test or a Cologuard. A FIT test being a test that looks specifically for part of basically looking for blood in the stool, a specific part of blood or hemoglobin in the stool. A Cologuard tests for certain abnormal DNA in the stool, so it's also a stool test, but it checks for DNA and also sometimes blood. And then there's a colonoscopy, which is kind of the gold standard in terms of colon cancer screening, which essentially, again, is a long camera that we place, through the colon and to take a good, careful look for anything that looks abnormal.
Okay. Okay. I know for me, some of the preventative things we're doing your colonoscopy at a certain age point, and having those studies done. Can you talk a little bit about that? And I think some of the age restrictions as around when insurances will pay for those have changed as it relates to disease prevention and early identification.
Absolutely. So, unfortunately, over the last couple of decades, there's been an increasing prevalence of early onset colon cancer. Actually, especially in the African American community, but throughout the entire U.S. Population. And as a means for trying to help remedy that, to at least some degree, the recommendation for colon cancer screening has gone from age 50 to age 45, meaning that basically all insurances at this point, to my understanding, now will pay for a colonoscopy starting at age 45 as opposed to 50. For people who are average risk, meaning just kind of a regular person with no significant family history of colon cancer and no kind of state that would increase their risk for having colon cancer.
Right. I'm really thankful to be having a strong relationship with my primary care physician. I think that's so important for individuals because she really keeps me on top of all of those key screenings and the changes and recommendations around when they can occur, which is so important to understand. So thank you for clarifying that. There's a misconception around, maybe some different foods or things that you need to avoid that will decrease your risk of getting colon cancer as it relates to alcohol and all of those things and tobacco utilization. Could you talk a little bit about that for me, Dr. May?
Absolutely. So yeah, I think there's a lot of things that we know, and probably some things that we still don't know as we kind of continue to learn and research this area. There's no hard and fast rule for a way to kind of avoid colon cancer or avoid polyps. There's no perfect diet. But there's a lot of things you can do that will decrease your risk, at least to some degree. So, obviously, smoking cigarettes is bad for pretty much everything, including causing colon cancer and the development of polyps, which are the precursors to colon cancer. Alcohol, especially in larger amounts, can also increase risk for colon cancer. So it's always with alcohol, less is better from that perspective, or none is good too.
Right.
Then comes the diet. So basically, there are certain foods, especially things like bacon, processed meats, red meats, which can increase the risk of polyps and colon cancer. We basically recommend as high of a fiber diet as possible, as much kind of vegetable type product in your diet as possible, and really decreasing the red meats and especially processed meats from the diet as much as possible.
Okay. All right. Great. Great. And then obviously the one that I struggle with the most myself is the weight. And including that physical exercise. And every time I feel like I've reached my target zone, the BMI parameter for obesity changes. So can you talk a little bit about weight and the impact that it has on colon cancer?
So I think BMI is very useful, but it's not perfect, right? So I mean, everyone's body is a little bit different. So it's not like a hard and fast rule that exactly this BMI is perfect for every person. But generally speaking, we're looking for a BMI between 18.5 and 24.9 to be considered a healthy body weight for most people. If you can kind of maintain a healthy body weight, that significantly decreases the risk of a myriad of illnesses and diseases, including all sorts of cancers, to include colon cancer and polyps. Certainly, when I do a lot of colonoscopies, and I see a lot more polyps in people who are overweight. So that risk continues to increase the further you get away from the normal BMI. So, having a BMI of 27 is a lot better than having a BMI of 37 or 47. So it's all kind of graded in that way, but certainly trying to aim to have, a healthy BMI with healthy diet, kind of which we've already kind of discussed, as well as regular exercise can decrease your risk of developing colon cancer, but also all sorts of other cancers.
Okay, very, very good. As it relates to some of the risk factors that we can't control, and we've talked about some of those as it relates to ethnicity and some of those things. Talk a little bit about type 2 diabetes. I know that's something that is really prevalent in my family. I actually was pre-diabetic several years ago and was able to get on top of it and now have a A1C that is within normal range. So would you talk a little bit about diabetes?
Yeah, so basically, diabetes is all part of the idea of kind of metabolic syndrome. So metabolic syndrome goes along for a lot of people, well, in general, with a high BMI, high cholesterol, high, basically centripetal obesity, so meaning kind of a larger belly, and those sort of things. Type 2 diabetes is kind of interesting because it kind of falls in between the can control and cannot control categories, because there's a lot of genetic components, but also a lot of lifestyle components that go with that. So it kind of fits in with this idea of regular exercise, eating a healthy diet, and maintaining a healthy body weight. You kind of look at some of these risk factors that are kind of really fully, completely out of somebody's control, which would be things like your family history. So basically, how many people in your family have been diagnosed with colon cancer, especially as a first-degree relative, so your sibling, your child, or your parent. That's kind of one of the biggest risk factors for developing colon cancer. Of course, if somebody has a known genetic disease that causes colon cancer, so something like familial adenomatous polyposis, FAP syndrome, or Lynch syndrome, those are two genetic diseases that cause colon cancer, and we have special guidelines for those sort of people, as well as we kind of alluded to previously. Certain ethnic groups, especially such as African Americans, are going to increase risk for colon cancer, likely for some genetic reasons and some socioeconomic reasons and some potential maybe stigma that may be around having a colonoscopy. There's all sorts of reasons that may be at play with that, but it all kind of centers back on you need to do the appropriate screening, or in the case of somebody who's at significantly increased risk, surveillance in individuals that are appropriate for it.
Or I'm glad you mentioned that. Why is the colonoscopy the preferred method? And also, there's a lot of angst as it relates to having a colonoscopy done. I had mine at 45, and I don't remember it, right? And so, I know people kind of dread. The prep was the hardest part of the procedure. The rest I don't remember. So, would you talk a little bit about that?
Yeah. So whenever I see patients, especially when it's their first colonoscopy, I kind of congratulate them on already having completed the hardest part of the test, which is the prep. So exactly as you said, it's really a colonoscopy for 99% of people is really not a big deal at all. You're under certain types of sedation. Most people don't remember the procedure at all. Certain people choose not to even have sedation because it's really not a particularly painful procedure. They'd rather kind of watch it on the screen and see what's going on. I know when it comes time for mine, that's what I'm going to be doing, so I can kind of like micromanage what the other gastroenterologists are up to, making sure they don't miss any polyps. But yeah, it's really not a bad procedure for almost every person that has it. Rarely there's people that have the procedure kind of under lighter sedation that may have some discomfort, and we can always then increase the sedation to a different type for them next time to be more comfortable in those rare circumstances. But yeah, definitely the prep is extremely important because we need to be able to see properly in there. But that's kind of the worst part. It kind of sucks to do the prep, of course. But I think the colonoscopy is the best test because it's kind of like a one-stop shop. if you undergo other sorts of testing, such as the stool testing like we talked about, those tests are not quite as sensitive or not quite as good at picking up colon cancer or advanced polyps. And when they do, you basically then have to have a colonoscopy to actually address that issue. So a colonoscopy is kind of like a one-stop shop. You come in, you actually can prevent the development of cancer with colonoscopy. So it's kind of the one screening test that exists that not only screens for cancer after it's already happened, but actually that can prevent the cancer by removing the cancer cells or kind of pre-cancerous type of cells, I should say, prior to them turning into a cancer. So by removing polyps.
Okay, definitely. It sounds like the colonoscopy is definitely more comprehensive and could detect things that you clearly would want to know earlier than later.
Exactly.
Well, Dr. Nay, that is very helpful. I'm really just appreciative of your passion and all the work that you're doing in this space. Is there anything else that you think would be helpful as we continue to educate our patients, families, and the communities that we serve as it relates to colon cancer prevention and also screening?
I'll just say, it breaks my heart every time that I diagnose a colon cancer in an individual, especially when it's a case that probably would have been prevented if they would have followed the guidelines in terms of, having a colonoscopy at the correct age or some sort of colon cancer screening. If you're scared of having a colonoscopy and kind of want to just try to get away with just doing a FIT test or a Cologuard, it's completely fine. Everybody just needs to get colon cancer screening of some kind. You don't want to be one of these people that regret, doing this once every 10-year test, and then end up having a colon cancer. It's really not worth it. And make sure that, especially if you're an individual who's had colon cancer or a history of, advanced polyps, that you make sure you let all of your family know as well that they would be at increased risk and should be getting their colonoscopy.
Absolutely. Great information, great feedback. You heard it here. Get your screening. Thank you so much. Thank you for listening to this episode of Healthy You. We're so glad you were able to join us today and learn more about this topic. If you would like to explore more, go to riversideonline.com.